Can I request others to please mute themselves? Am I audible, Dr. Abhishek?
Sir, yes, you are audible, but
You are audible.
volume is slightly less.
I'm not able to see my video, so I think there's some problem with the video. Okay, it should come now, I think. Yeah, okay. Okay, good evening, friends. This is our second Dean's session of the Indian College of Cardiodiabetology and Metabolic Diseases after I took over as Dean in Varanasi. The first session we had Dr. Zagar as our staff speaker. And for this session, we are having another star speaker, the most beautiful Dr. Imarati, who is the AI expert from Bangalore. And we have none other than the founder member of Doctors AI. I remember about more than 10 to 15 years back, Professor Dr. S.P. Kulkarni, who is the founder member of Doctors AI, and a keen AI enthusiast, was the lone crusader in most of the APICON meetings. He used to have a second, and he used to always invite me, Dr. Virmani, and come and see how we are going to enter the digital age. 15 years ago, I was very skeptical, and I said, "Sir, network to kaam karta nahi hai, kya ye seekhenge?" But then, things, a lot of water has gone under the bridge. We have entered the digital age, and we are now we know that AI is not only knocking on our door, it has entered into our lives with smartphones. Connectivity has improved a lot with broadband and fiber systems. And now I'm told Elon Musk is coming with a fiber net where it will be through the satellites. So there will be no broadband and no fibers. And it will be available even on the flights very soon. And even the Ministry of Civil Aviation has now given its consent that you can use air connectivity, net connectivity even on the flights. So we are entering into a new era of digital age. Most of us are already using AI in our smartphones, in CGMs, in glucose monitoring, in the ambulatory blood pressure monitoring and whatnot. And AI has really raided, I will say raided the healthcare system. And there are a lot of skeptics who are still afraid that it is going to replace doctors. But let me assure them that if you are good enough, AI can never replace you. But doctors who do not use AI will be replaced by doctors who use AI. That is a fact. And we have to now embrace this new technology. We have to be a part of it. We have to learn. Even I am in the learning stages, though I have joined Doctors AI. I'm taking active part with them. And of course, Dr. Kulkarni has been my guide, mentor. And then my good friends, Dr. Alok Modi and Dr. Amit Jain, Dr. Bharat Prabhu, have initiated me into this discipline. And I got a lot of interest into this. And these sessions are going to continue in January. Dr. V. Mohan will be joining us as the staff speaker. And in March, we are planning to have, end of February or first week of March, we are planning to have a half-day workshop on AI with the Doctors AI supported by USV. And this is how we're going to proceed for the rest of the year. But as for today, I think Dr. Kulkarni, as I have introduced him already, I would request him to take over as a chairperson, introduce our speaker, Ima Rashid, and please go ahead with the program. Thank you very much.
Thank you, Dr. Virmani, for a. Am I audible clearly?
Yes. Yeah, absolutely.
Yeah. Ima, I just saw your CV. It is absolutely impeccable, fantastic, and I am one of the end product user of the thing which you are devised. So, without wasting any other time, I will request you to start with your presentation and have more and more interaction. Friends, it is said that AI cannot be taught. It has to be learned. And it has to be learned by click, side by side. Over to you, Ima.
Thank you so much, sir. I'm audible to everyone?
Yes.
Yes.
Yes. Yes.
So, hello everyone. Good evening. Namaskar. And it's an honor. Really, I'm very thankful for Abhishek to reaching out and to speak in front of such esteemed personalities and my seniors and talk about the most transformative thing that has happened in the healthcare is AI. Is itself. I mean, it's an honor and a privilege. So I would not waste any more time. And let's begin into the journey of AI. So since it's our first session, what I'm trying to do here is what I'll try to do is let's just get to the basics of AI. There is a lot of questions. There's a lot of doubt among the doctor fraternity that what exactly AI is doing and how it is helping the medical fraternity, especially the caregivers. So before starting, I'll just present my screen. I'll share my screen. There's small slides and I'll go ahead with the one by one. I'll take one by one. So let me just this. Yeah. Yes. So I'll go ahead one by one. First, let's just understand that what AI is actually. So what do we mean by AI in clinical? So clinical AI is the application of AI technologies, so artificial intelligence technologies into healthcare settings. Now, this healthcare settings could be your EMR data, could be wearable devices that the patients use. So whatever technology we can use in healthcare settings to actually, there are three main things that AI does. It improves the patient outcomes, it streamlines the process, and it enhances the clinical decision-making of a doctor. Like Dr. Kulkarni, like Dr. Virmani just said that it isn't there to replace the doctors. So that's the first thing I want to say, that AI can and never replace doctors, because AI, we can take AI as a very efficient physician assistant. That's what AI is. And if we use it and if we utilize it properly, it's the best physician assistant that a physician can get. And how it is? So it involves profound and it involves a vast amount of medical data. So here, like when we were studying our medicine, we had to go through textbooks and practical knowledge and then vivas and to understand. Here, the data is the main course. It's the brain of AI. So how AI is driven is it's driven by the vast amount of medical care data that we have. And believe me, apart from all other data, the biggest database that one can have is the healthcare data. The only drawback here is our data is not that well maintained. So this is the only challenge that we actually get in our practice also, that the data is not maintained. We as doctors also, when we write, probably the past history also we write in the diagnosis. So when this machine analyzes the data, it picks up important histories from the patient profile, including medical history, surgical history, family history, diagnostic tests, lab tests, and then over it, there are some algorithms. From technology side, I'll not go into the details of the algorithms because it will be slightly confusing, but the algorithms are machine learning and deep learning. So this is through these algorithms and over that medical data, it gives us recommendations. So that recommendations could be most probable diagnosis. It could be what is the next best step for this presentation of a patient. What can be the treatment plan? What can be the personalized plan? So when we talk about AI, AI is the application of artificial intelligence technologies, including machine learning and deep learning techniques over vast amount of patient data, including patient history, laboratory diagnosis, diagnostic imaging, and give us some recommendations. So on the screen, if you can see the categories, these are the major categories which on which this our healthcare settings, I mean, for the caregivers, doctors, and patients rely. So there are many other use cases for AI, but since we are talking about healthcare and doctors and patients, so I'll take up these five main. So let's talk about the category one, diagnosis and prognosis. So how does it do that? So it analyzes the medical data that we have. Now, like Dr. Kulkarni said, in Apollo, we have vast amount of millions of data that we had. So we know that how a patient's trend or how a patient's history is going on. So all that is taken into consideration, and taking the symptoms that the patient has, taking the past history that he's giving us, it is combined with those AI technologies, and the recommendation treatment plans or the diagnosis is given. Now the app, on top of that, we can also use things like which understand the imaging. We can upload the imaging and it understands whether it's normal or abnormal. We upload a laboratory test and it understands it's normal and abnormal. And taking all those parameters, it gives us the next best steps. So now the question comes that this the doctor can also do. What's the special thing about it? But it is, what it does is the doctor and the medical fraternity is also overburdened by the patients. When we wait for the patients in our OPD, when we wait for them, and there is a long line, and the patient history taking is also not very fluent. When they come to your office, probably they'll forget few things. While saying, they'll say all the things that are not important, and you kind of have to keep on asking them leading questions to get to that point. So when I talk about operational efficiency, here's what AI does. So आप ये सोचिए कि अगर कोई chatbot है, if I have a chatbot which is AI driven, and it's not a very yes or no type of a question. When I enter a cough for a 60-year-old geriatric patient, or when I enter a cough for a 9-year-old child, the kind of leading questions are always different. This doesn't happen if we do not incorporate AI into our system, because the AI understands by reading the vast amount of medical data or the IP admissions and the OPD admissions that when a 9-year-old patient is coming with cough, what were the associated symptoms with that? What did the doctor write in the notes? What tests were done for that child? So through that, the chatbot actually progresses. So when it asks about the pediatric patients, it asks different set of questions to a 60-year-old geriatric patient or 70-year-old geriatric patient. So this is how we kind of ask leading questions, and it gathers all the important info about a patient who is coming with a presentation. Now imagine you're waiting and there are a lot of patients in your room. Now everybody has got a slot. So we have a chatbot. We have a chatbot, and we ask the patients to please come in, add their details. It's like a junior doctor taking the history. It's exactly like that. So it asks about what's the age, what are you looking for, the symptoms. Then we ask about relevant past history. If a patient is known to us, the past history is already taken into consideration. Then it asks about what is troubling you the most. And the way that we go Socrates method. So we ask about each and every, like it's an abdominal pain. So all the important aspects of abdominal pain is being asked for the user, for the patient, and in a very patient-friendly, user-friendly language. So before getting into the consultation room, you have all the important info already available in the chatbot, and that we showcase it to the doctor. So even before meeting the doctor, you open your dashboard and you have the entire history well taken with the leading questions that sometimes even the patients forget to tell. But when we ask them the leading questions, they kind of answer it. So you have on your dashboard the entire history of a patient. You have what past history he had, what kind of medication he has taken. So your clinical decision-making ability increases tenfold. You don't have to, you can just ask, or you can just validate the answers from your patient that, okay, you reported this, do you have it? So this improves the clinical decision-making, and it also hastens the process, and it also gives us a streamlined data, which can be used in future also. So it's like a two-way process. We are trying to build, we're trying to get the healthcare data into one place in proper EMR records, in proper EHR records. So diagnosis and prognosis, that's how the AI is going to help us. Now, when we talk about personalized medicine, so how are we going to do that? Now, AI processes large amount of data sets. So we know the lifestyle history, we know clinical genetic history if it's involved, especially for chronic condition, chronic management of people with diabetes, people with chronic asthma, people with any autoimmune disease. So it has it analyzes large data sets, so we know even the treatment plan can be personalized. So it's not only taking one thing of a patient and just telling, okay, you have cough, you have fever, this could be flu. You have cough, no, it analyzes, and personalized info we can give it to the user or the patient. So this is one side. Then operational efficiency, as I said, that since it will be so streamlined that even before going into the consultation, on your dashboard, you have all the relevant information of the patient, that too in a summary, which actually the junior doctor gives. So we have asked some 20 questions, and that 20 questions is in a form of summary. And you, in one glance, you'll know that what is this patient about, why is it coming to me, and what next I can do for him. So operational efficiency is one thing, and incorporating this into hospital settings, clinical settings, the other inventory management, improving operational aspects other than healthcare is also improved. Then comes a very interesting topic is predictive analysis. So how does this predictive analysis works? The predictive analysis works where AI has the ability to understand the historical, like the trends. So it analyzes the historical data and it analyzes the trends. So in a particular place, we see what is the trend of the patient's admissions at a particular time, or there is a sudden surge of patients in a particular department, or there are patients with long-standing diabetes admitted, they are undergoing surgery. So when we tell them, there are some general rules that we tell our patients when they go into a surgery. So see, you have diabetes, you have this, these are the risks that can happen. That's a very basic thing that we inform our patients, and even we know that. But how much risk is that patient to develop that sepsis? It's never calculated, because we analyze it and we tell that, okay, you have this disease, you might develop this. But AI has the functionality where it addresses entire database, and you can add those lab data, you can add the lab values of the patients and see that, okay, he'll be in this kind of a surgery. Now, how long this surgery takes place and what could be the outcome or the prognosis of the patient after this surgery. That is actually calculated and with scoring and risk if you use predictive analysis. So this is where the healthcare workers can prioritize patients. They can be more proactive with the preventive health. And when we talk about community health as such, or a population health as such, this is very useful, because in a community, and especially for community health medicine, so this predictive analysis can tell us that which outbreak is more common in this area, how many people with this risk factor can develop this disease. So it actually gives us a very solid score. And we understand that, okay, this part of the problem we have to deal much better. Then comes the virtual health assistants, which is diagnosis and prognosis I spoke about, which asks patients queries like chatbot. So we have developed that one in Apollo, which is called Clinical Intelligence Engine. It's there for the users. Before going into the consultation, they can talk to a chatbot. It asks questions, and we recommend them the top specialists which they could meet. We recommend what lab tests they could do depending on their symptoms and presentation. And then what is the self-care? Till you meet a doctor, what is the self-care tips that you can do? So there is plenty of things that we can inform a patient, and that improves the patient outcome. So now the question comes that, is it really useful to have a chatbot? So yes, it is useful. Now, enabling a patient with symptom checker. So how does it help in a patient's journey? The era that we are living in is actually very, the people are well read. People want to be involved now. How many people in the OPD now comes and they want to be a part of your journey, of their journey of treatment? They want to be equally involved. We have seen that trend among the patients. They want to know what is being done, why it is being done. There are plenty of questions that they have. So seeing all these things, it is also seen in the trend that this many percentage of patients, when they were engaged from the very beginning of their treatment, had a better outcome. So why not give them a tool? Why not involve them in their treatment journey till the end and keep them informed? So this is where the symptom checkers and chatbot comes into play, because we are involving them from the first. they are the ones who are picking up the chatbot and telling them how they are feeling. What are their symptoms? It's like a very, and the chatbot is also not created as in a very robotic inquiry. No, it should
तो
have.
उसको टेस्ट करते वक्त
So it should have empathy along with that. It should understand the patient's and should understand the patient's tone. And we ask the questions like that. So we try to make it as human as possible. And the best part about AI-driven chatbots is the questions are never very robotic because it's coming from the huge amount of data sets that we have analyzed, depending upon the demography, gender, symptoms, presentation. So the best ways to be done is support the patients from the beginning of their diagnostic journey. So like I said, in the recent survey, there was 75% of medical profession survey thought it was helpful to have an overall involvement of patients, and it actually helped with their relations. So when we talk about and chatbot, so there are things where you can actually involve the patient is the wearable devices. So they can use the chatbot. And as we know, there are wearable devices available now. So in the form of smart watch, in the form of continuous glucose monitoring. So all these technologies, if we incorporate in our chatbot and it understands what a patient is going through. So a person who has a problem of arrhythmia, and if anything is picked up and it gives a nudge to the doctor on the dashboard. So it gives us that double edge, or it gives us that edge in patient response and doing a preventive, doing something before it just worsens. So when we talk about this, it's like there are so many other wearable technologies that are used now, and this is how the AI works. So we have to, this is how APIs work. So both of the machines talk to each other, and it gives us the information, and we incorporate the EHR, the electronic health reports, to that wearable device. So anything that is picked up there is for the doctor to understand. So there was a spike of sugar. Okay, when was the spike of sugar? This happened before you had a meal like that. So till the patient comes after 2 weeks to you, before that also you will have that info. So especially in chronic medical conditions, it is very, very helpful because it sets up a trends. And all the treatment depends upon the trends, how the patient is reacting to the medication, or how he is reacting to certain food items, how his blood sugar spikes. So it's never a one-time thing. Then I'll take you to the CDSS. So there are two parts to it. Like how we discussed that when we talk about AI has a patient-facing platform, and it has a healthcare, a doctor-facing platform. It helps both ways. It's like a two-way engine. So patient-related, I just spoke about it, that how chatbots can involve the patients and how they are involved, so they are more comfortable and they report better symptoms by that. And once they report better symptoms, the outcome is also better. Now, how does it helps the healthcare professionals? So that's called a clinical decision support system. So this clinical decision support system, it is a software which has which use evidence-based medicine, and it helps the clinicians to make informed decision about the patient's treatment. So it could be personalized also. There are care pathways that are incorporated. So we know that, okay, a 10-year-old boy is coming with epilepsy and he has this history. So there are care pathways to go about it. And CDSS really helps in remote settings. It's like a blessing in disguise, where probably there is a short of staff, or we kind of have very basic only general practitioners there, where we don't have specialist. So it's not very easy to reach out to a specialist. So there, this clinical decision support system really helps. So we can add that to a very small clinic in some remote area, where the nurses, where the Anganwadi workers and all can be trained to use it. So a patient is coming with certain complaints, they can just add those complaints and give the history, and the entire decision tree is going to come in front of them, what they have to do next. So it is of immense help to the community as well, because till you reach to a specialist and till they reach to a specialist, it actually helps save lives, and they know, okay, what next steps to be done. And this is updated This is updated regularly by evidence-based medicine. So this is how the point of care has now changed. We can do a lot by digital, and that's what COVID had taught us. So this digital era, even an Anganwadi worker, even sitting in a remote area, a very senior nurse can actually make use of this clinical decision support system and go ahead. And then as and when we improve the algorithm and we improve the decision-making algorithms, even it helps our doctor fraternities also, like specialists also can use that because it has the latest info. So you can add all the details. And how we did it on Apollo group of hospitals is, this was under the leadership of Dr. Sangeeta. And it was a wonderful project. And we created a library where we created from most common, rare conditions, we created library. It was created by doctors. It was reviewed by specialists throughout the Apollo hospitals. And each case sheets were reviewed 3 times, and there were changes done to it. So it had a complete journey of a patient. Like someone is coming with dengue, so all forms of dengue were captured there. That how normal dengue fever is there, hemorrhagic fever is there, and what has to be done. When do you need ICU care? What next steps to be done in terms of treatment? What is the prognosis? What is the risk factor? So it was a whole library that was created. It is reviewed, and that review happens every quarterly, and we do that review and we update that system. So it becomes like a library of ours, which becomes the brain of our chatbot, which we use. So अब जो हमारा CI का chatbot है, and it is there on Apollo 247, Apollo group of hospitals, the doctors who are doing digital consultations, they all have that on their dashboard. So they can see what the patients have added. They can check that how the inquiry happened. And the brain of the inquiry was our CDSS, what we created, our knowledge base. So where we have, now we have around 3,000 conditions involving common, most common, rare, and different variations, including pediatric. So asthma in a pregnant female, asthma in a pediatric patient, asthma in a 70-year-old man. So all those variations are captured. Now, this was the brain of our chatbot, which I spoke earlier. This is how chatbots work. We have to make a library around it. And this CDSS helps in the inquiry making. That's how the next leading question comes, as in a doctor is only asking it. So very informed, very to the point, and depending upon the last input of the patient. It's not a very robotic chat. No, what I've added before, the next question comes in terms of that. So this is how the AI works. And this is where AI is helpful. So this is about CDSS and how it can be built. CDSS can be built in the system. We can use care pathways. We can have a third-party access. It all depends on how we use the CDSS. So in this slide, you can see that how it is useful. AI is useful for consumers and doctors and caregivers. So for consumers, it's patients. They can discover the right doctor by searching the symptoms. Now, many times I've heard people with vertigo. Now they don't know. There are a lot of people who don't know where to go. So they kind of look into the neurologist. They look into general practitioners. They don't understand which doctor to book. So this is how it helps. Now they open our chatbot. We ask, what is the problem? Okay, you have dizziness. Now there are certain questions that are asked. What is the onset of the dizziness? How severe it is? What are the associated symptoms? So the associated symptoms have been curated by our CDSs only, by the specialists that have reviewed, by the team of doctors who created. So we know now if the dizziness is associated with neuro symptoms, definitely the diagnosis goes towards neurology. But if it's more towards benign postural vertigo, then it goes towards the ENT doctor. So how do we differentiate this? By asking the right kind of questions. And that's what AI-enabled chatbot does. It doesn't pick up just vertigo and tell you that, okay, you have dizziness, you go to this doctor. No, you have dizziness. What are the associated symptoms? So there's a mix of symptoms. There are neuro symptoms, and then if it's a pregnant lady, then the inquiry changes completely. So it asks about details of pregnancy also. And then the diagnosis and the treatment plan and the recommendation, everything changes. So the appointment booking becomes so easy. It reduces the cost of burden because they go to the wrong doctor, then they're referred to the other doctor. So it helps that. Then definitely DDX leading through services. Now, like I said, that the chatbot is giving me 3 or 4 diagnoses. Now we tell them that, okay, this you need emergency visit, or for this you have to immediately visit, or this can be an OPD case. You can book an appointment after 2 days, or only self-care can help you. So these things, this is the second point that can be done. And definitely when the chatbot happens, so many a times, there have been incidences where people have taken chest pain very lightly. They do not understand what chest pain and when to go to a doctor. So a chatbot has that. If we are asking that, okay, is this a sharp kind of a pain? Do you have any of these associated with that? So it kinds of highlights it to the patient that it could be something serious. You need to visit a doctor immediately rather than waiting for a consultation right away. So it guides the patient. It understands the triage also. So there are AI-based triage systems which are incorporated in chatbot, and we shift the users as per their symptoms, as per their presentations, how serious it is. No, headache along with dizziness, nausea, vomiting, you do not have to wait. You have to go. Headache by photophobia and a moderate to mild grade, it could be migraine. Yes, you can take an appointment after 1 day. But things like vomiting, dizziness, unable to stand is something where you need to immediately show to or visit a doctor. Then you can, for a probable, so symptom tracking users is the same thing. Then end users can search, AI can be built and made easy for the users so that they can search specific words. And how AI is used here is by NLP, natural language processing. So this is a natural language processing is a language of the computer, which understands textual data, which understands what the user is asking, and it gives them the answer exactly like that. So what they're searching for a doctor, they are searching for a procedure. So if they're searching for a gastroenterologist, all the procedures of GI, I mean, gastroenterology department comes up. So these are some things which makes it easier for the user to search rather than going and typing the whole thing. So it gives them the edge that, okay, you're looking for a gastroenterologist, all gastroenterology procedures or tests or lab tests will come up. So these are a few other things search functions can improve. Triage, like I said, that how it helps a stroke, a headache, a normal headache, a very basic headache of migraine and a headache of stroke, how to identify. Users cannot identify them themselves. So that chatbot, that understanding of triage help the users to get help at the right time. Then condition management. Now, specialized versions for different specialities and conditions. So a diabetics, completely different platform is there for chronic condition management. Through AI, we can give personalized info to them. Okay, we know that this patient had a history of a diabetic foot ulcer. So everything will be taken into consideration and given that to the user to understand his journey. So it is never a one-time meet a doctor and understand and do the treatment. So it will understand the entire trend of the patient, how it was, how many emergency visits happened because of that, or what were the treatment given during that. So all that is captured in our database. So here the database is like the holy grail, and database is what builds this system, and data never lies. So if it is used in a proper way, it is very, very useful. And that's the brain of AI. Now for doctors and caregivers, it's like I said, that next best steps for CDSs, there are many use cases for that. A primary healthcare center at the remote area, or in our EMR settings or our hospital settings also, to help reduce the burden of the doctor also. So you have patients, you can prioritize patients who are more at risk, is undergoing surgery, who is more at risk of developing a sepsis, who among that, by adding their lab data, by adding their past history, by adding their medications, the data gives us the trend, and we can divide our attention towards those patients. Similarly, CDSs, when integrated with the EMR of our hospitals. Then care pathways. So when it's connected to the EMR, so care pathways gives exactly how we, and it is updated every time. So what are the new technologies? What are the new treatment modalities? What are the new approach to a patient like that? So it helps even the specialists. So AI is never ever going to replace the doctors, but it's like a very efficient physician assistant, which will help improving the patient's outcome. It will streamline the process, streamline the process in the way how we give the care from doctor to patient, and also operational. So in clinics, hospitals, it compiles the data and makes it very clear for us to understand. So it's like a two-way thing. We are using data to build something, and this also we are building up a lovely EMR setting where from this stage we can go even to more granular level, because healthcare data is a challenge in our country right now also. The only hindrance that comes in building a super intelligent model is we have not maintained the healthcare data very well. And it is because of that, because in the prescription, we have written past history also in the diagnosis. There are certain labs also written, lab values also written in the diagnosis. So this needs to be streamlined. And AI is going to help us do that very efficiently. So now we have spoken a lot about all this, but whenever AI comes to picture, the ethics always comes as a question. Is it ethical? Can we do that? Yes, because we are maintaining the privacy of the patients. That is foremost important thing. Privacy of the patient. So when I talk about like ethics for AI, there are only two things that come to my mind is privacy of the patient and safety of the patient. So as doctors and caregivers, it's a responsibility. The patient safety comes first and privacy comes first. Since we are using their data to build up something, their consent is always needed. So that, and you have to anonymize the data. So there is no personal info, no entry of the patient which has any personal info about the patient should be used in creating any of the algorithms. It's already, this is how it happens in, technical aspect is, it is completely anonymized. So the only thing we know is we know the age of the patient, the gender of the patient, the past history, that name, address, any doctor they have consulted, the name of the doctor, everything is hidden except for the specialty. So anything by which you can identify a patient should be anonymized completely. That maintains the privacy of the patient, and it's ethical to do that because we are using their data. And yes, whenever we ask them to fill in, there's a consent form right there, which tells them that, yes, we'll use it, but it is not going to be, we are not going to use your data or in personal info to build this up. So consent is one thing. Then comes patient safety. So for patient safety, it becomes a responsibility that all this AI-driven procedure should always and always have a physician overlook. So a doctor in the loop, what we say, a doctor in the loop, that is very important. So for any AI system to work like it's working now, we should have a team of doctors who overlook each and every algorithm, understand how it is going. Multiple testing is done. Technical side, there are other testing which see that how the product is working. But then there is a clinical team which looks into tests, analyzes. We test it through several vignettes that, okay, how our system is working. So that overlook is very, very important. Without that, we cannot build a safe AI product. So the same we are doing at Apollo also. We have our doctors in loop. So always keep the doctor in loop there. AI is never given as a blind, and other things where the search engine and all, this is where it is not hampering the safety, the patient safety. But when we are giving the differential diagnosis, labs and everything, so there we need the algorithms to be reviewed by a team of clinicians and to have that doctor in the loop. Even before going to a triage, or we are telling that, okay, this needs immediate attention. We have a doctor in the loop to identify that, yes, what the AI recorded is right. So there is always a confirmation call. And we also know that which calls to take first, which appointments to take first. This user is coming with, we cannot wait a user with chest pain and sweating for 2 hours and give the appointment. So this is all which is analyzed by the AI. And then when it comes to another important thing I wanted to talk about that everyone is talking about is ChatGPT. So now how we know that, okay, what is ChatGPT? ChatGPT is also an AI technology, but it is a large language model. So what ChatGPT does is it only takes textual data all throughout the internet, whatever journals, books, or it only reads textual data. So when you add some details there, it will analyze whatever textual data is available right away. And it gives us that, okay, a 20-year-old is coming with cough, fever, he has this, and it gives us the diagnosis. But it will never be personalized until we add some machine learning to it. It'll give you a very general kind of an info and what has to be done. But the chatbots that work on machine learning and deep learning use other AI technologies. Those give us an edge over that because you can use their personal data and create their personalized health plans. LLM is developing at a massive scale. What we were probably 3 or 4 months back, now it has been advanced even more. More and more new versions are coming up, which is overcoming all this. It identifies a patient's condition with just 2 questions, and that too with a good sense of accuracy. Why is it happening? Because AI is developing that fast. They're using technologies over that. Earlier, chatbot was a textual kind of an information. It gives you a very general thing. But now, with the other versions that are coming out, with Strawberry version, with GPT 4.0, they are also involving other deep learning technologies, and it is giving us even better and better results. So this is how we are at a place where technology is developing at the speed of 10x. And we as healthcare professionals also, it's our responsibility that something so promising and something such with build up with such profound truth, that is a patient data. Patient data never lies. So we have to, it's our responsibility also to give this a chance. And it can never be done until we have clinicians, we have research scholars, we have doctors involved and accepting AI as a part of the clinical practice. So as a whole, if we kind of incorporate this in our systems, work on this, then definitely moving ahead within a couple of years, we'll have a data where we'll not have any errors. Right now, the healthcare data is everywhere. So this is like a two-sided, what should I say? It's like it works both ways. So it takes the well-formed data, gives you some brilliant results, and you use AI in your EMR, it is again going to give you super informative patient records. Now, how it helps? So clinical trials. Now, clinical trials is one thing which AI is going to break grounds in. How much of effort, work, and how much of what should I say? The quality of work will improve 10 times if we use this in clinical trials, because it will predict the outcome. Now, there are some exclusion criteria and inclusion criteria in each trials. Now, it has to be entered. The doctors have to enter it in the EMR. With the revolution of AI, what all patients we have, we can find those best patients within our system only. That these are the patients that fit our exclusion criteria, we fit our inclusion criteria, and this will be a seamless operational requirement. So the operational thing would be so smooth, because this AI has the ability to understand, okay, diabetes from this is an exclusion criteria, lab value of this. So it identifies those patients. So clinical trial is one groundbreaking work. Now, I've worked for Oxford AstraZeneca when it happened, and we saw the patients were all from Florida. So the database, if they have, so if you open their database, it was like as if I'm seeing a patient in front of me. It was so methodical, right from the pediatric, like what happened as a child till now, each surgery, each medication, each reaction, each drug reaction, each side effect, all given in a very well-formed EMR. This is how it gives that edge and that seamless operation of a clinical trial that happened. So these are few points which I wanted to discuss in this call, and I think we have more time, then we can discuss more. Have I taken all the time? I hope I'm not going very fast.
One suggestion is now you wind it up. There are many questions, and there are very questions which are very, very common.
Okay.
And that will be more interacting. So you finish with your 1 or 2 slides, which are, thought-provoking and creating some
टीवी नहीं है टीवी नहीं है
in the patient's mind.
तो पापा ने
Sure, sir. So this was all about that. I wanted to tell that what AI and how in their first call, in our first interaction, that where AI stands right now, how it helps us, and where is our medical fraternity right now. So questions, please. I'm all for it.
Okay. Thank you very much. Thank you, Ima. It was a very well orchestrated and very fluently interwoven presentation. You started with the introduction, with your 5 favorites, which are very important. Then you talked about the checklist and the chatbots. And I just like to inform the audience, which is almost 60 now, and seeing so many familiar faces. Dr. Ritul Gupta is there and Dr. K.K. Parikh, everybody. So please read a book called as a Checklist Manifesto. This gentleman is the Dr. Atul Gawande, and he's a medical doctor, he's a surgeon. He is paid per word by Washington Post. It is a fantastic book, but that checklist manifesto has come to medicine with the help of your chatbots. A wonderful way of taking about symptom checker. NHS officially approves symptom checker, and CDSS. CDSS is a real blessing in disguise if it is used properly. I recall so many patients and so many clues that you can help the patient to manage that. And the review of system which has to be taken. The review of system can be taken all very good. Like, there is a concept called as a software as a tool or a software as a drug. In this situation, your symptom checker fits best. How to order the test per symptoms. And you recall Steven Spielberg's movie, E.T., like that, what you did, there's the evidence-based, it was technology-based, it was experience-based, and how AI can help a healthcare. And without, your 3 major points of privacy, personal information sharing, and safety. So there are lot of questions here. I'm very happy to see Dr. Alok Modi, who is my good colleague in Doctors A, and we are always back to back or together flying, every weekend to different parts of the country. And this is a big initiative taken by the Dean Sir to propagate this idea. So I will take few questions, and I think that is with that we can just go on. So there is one question Dr. Snehata has asked. First is Dr. Mrutyunjay's. That concern is quite genuine. For simple example, earlier we used to memorize many telephone numbers. Now even if we don't remember one mobile number except for your wife. So artificial intelligence can make us inefficient in some way. I just want to add one point to this. Artificial intelligence is not artificial intelligence. It is augmented intelligence. It is the assistive intelligence. We all who are attending this program, who are screen on screen, we are already very intelligent people. And the technologies of AI are going to make us more addicted to that. But Dr. Ima or Dr. Alok, what is your say on this one comment which here done? Concern is about genuine, and it is going to make us, is it going to make us, technology enabled idiots in some different way?
No, it will not do that. It will give you more time to put your time, your precious time and efforts on things which are more productive. So it will give you an edge there rather than remembering things or remembering that can be done by a machine. But your time is very precious, and so you can give it to your patients, you can give it to research, you can give it to technology.
It is the speed and the rate with which it works is more important, and the way in which we collect so many things at one go. Friends, I will tell you from my own experience.
It is just like
AI is one of the best vaccine against Alzheimer's. You will not get Alzheimer if you start using AI. Now, there is one more question.
Dr. Kulkarni,
Yes, Dean sir.
Just to answer that question, you have very rightly said the definition of artificial intelligence has now changed. It is no longer called artificial intelligence. because we are using it to supplement human intelligence. And that is why it's now known as augmented intelligence, as Dr. Kulkarni very rightly said. But I think it is more like, you're carrying a mobile encyclopedia with you, which you can consult anytime for making decisions. So your brain is not going to be affected, your decision making is not going to be affected, your contact with the patient, your empathy, all that remains intact. All that you get is extra knowledge to help you take a correct decision.
Snehalata has asked, see, it is very interesting. When we use AI tool, it gives us diagnosis, treatment plan, everything that we want to do it in just less than few minutes. Does it mean that our brains will not work to think or recall regarding patient diagnosis and treatment plan? Will we lose our intelligence or good clinical sense? It is a nice initiative, definitely good one. But her query also is genuine. Ima, in very quick words, how you can tell Snehalata that how AI is going to pick up some of the rare conditions or common disease with rare combinations. Suppose I have got a ECG of WPW syndrome with ventricular tachycardia. I may not recollect it, but if I put that ECG in ChatGPT, it may tell me that this looks like a ventricular tachycardia or atrial fibrillation with WPW syndrome, because that ECG has picked up one smallest PR interval and one of the delta waves, which my eyes might have failed.
Yeah.
Your take for it, and then I will request Dr. Alok also to comment about it.
Yeah, no, since the AI gives you the treatment plan, it only guides you, it only suggests. It is not telling you that this is what you have to do. It gives you an option of the best treatment plans to move ahead with that patient, taking the past history, medication, surgical, everything intact. So it is like a junior doctor who's working with you and giving you an edge over that. So it's not going to, you are not going to, doctors will not just pinpoint that what is given. It gives them an edge. It gives a better understanding of the situation. Probably there are few things, human errors. Every day it happens in OPD. So there are human errors. Probably something is missed. And because of those suggestions, you can reach up to the patient and say that it's better you get this test also done, because it's there and it might be missed due to human error. So it gives us a suggestion, never tells us the whole picture. So that is only a doctor's call. Want to add it or want to take it into consideration, or they want to move ahead with their own. But this is like a suggestion given to you, which is not just popping up out of Google. Those suggestions are coming with proper history of the patient.
Thank you. This is just like driving a car. You are in the driver's seat. You have to decide when to change the gear and when to speed up the things. There are certain ways in which you have to take the car in the first gear when you are going steep up. So please remember that doctor is responsible for whatever errors, omissions he makes while using a AI related tool. So before Alok tells, Alok, it can be in continuation way. Prahlad has asked, please, how to select a EMR? If possible, give the names of best available. So both, it is a question for both of you. You will definitely recommend Apollo 24/7, no doubt.
No, that is, see, EMR is based out of every hospital would have that. And then there are third party people where if in clinics and all, if you want, then that can be built. But every hospital or there is a technology used for that. So I would not be the expert to tell the technology involved in that because it's a completely different software. I'm more towards the clinical one. But if you're looking for for your own or for your clinic, something, there are third party vendors which you can reach out to. They are building lovely EMRs.
Yeah. Alok, you are safe.
Yeah,
Hello.
good evening, everybody.
Yes.
Sir, Varmani sir, many congratulations for this wonderful.
Dr. Deepak Chauhan, please mute yourself.
Alok, can you, your voice is not very
No,
good.
I was muted, so
Go ahead.
so I was saying many congratulations, Varmani sir, for this wonderful initiative.
Thank you. Thank you.
The host is muting me, so I'm not able to answer. I'm getting muted again and again.
Muting the host cannot mute.
Anand, please open the forum for all.
Okay, sir.
Abhishek, can you
Yes,
unmute
yes.
Dr. Alok?
Please unmute Dr. Alok, Dr. Deepak.
Yeah,
Please
okay.
unmute all can discuss now.
Okay, sir.
Alok, please go ahead.
Yeah, so what I was saying is I wanted to congratulate and give my regards to Varmani sir for this wonderful initiative. And madam, a wonderful presentation, lovely way to explain and a lot of things to learn, carry home. The question is very simple. I'll give a very clear, simple example. Suppose we have got a cardiac Kikashi syndrome. We have got a tough case, pyrexia of unknown origin. What do you do normally today? When AI was not there, we would get other colleagues involved. We would refer them to an institution, work upon the case and work like a team, right? It's today doctors don't treat patients alone. They take multiple brains together and form a team. If you consider AI without getting threatened by AI, and if you consider AI as another team member, another doctor at your bedside, sitting from your laptop, with all the knowledge that you have, probably more than you have, because the LLMs that AI has is much more. The database, the Azure part is much huger than you can, recall from your brain at that moment. And together, if you work and if you're using ChatGPT 4.0, which is supposed to have a personality, it is developing a sort of sentience. And if you have used it, you'll know how it responds to you. If you use it with a personality touch, and if you start working together on a patient, like Dr. Kulkarni sir said, it's an additive intelligence. You can make a hell lot of a difference to your patient's outcome and treatment. And only thing is we need not be scared. See, we have कोई भी नई चीज आती है तो हमें डर लगता है. It's a natural human tendency to feel, will I get replaced? Will it be a threat to my existence? It doesn't happen that way. We are using AI regularly in our day-to-day life, in our clinical practice. It is making life very easy and very smooth and a very justifiable for all of us. Only thing is you have to know how to tackle the AI. See, AI is like a very small, intelligent child. If you don't know how to ask the right questions, you will not get the right answers. So if you ask the right prompt, you will get the right answers. If you ask the wrong prompt, and that's another specialty of AI called as prompt engineering. People are getting paid 10 to 15 lakhs per month who are trained prompt engineers. So if you don't ask the right prompt, you'll get a wrong answer, and that is called as hallucination by the AI. So you have to learn that much how to tackle your AI in a proper, intelligent manner with the right prompts, and it adds a lot of value to your practice. Important thing to be noted here is this: is if you go through the history, when mobiles came, people were not using the mobile, right? They felt a telephone is a better. But today, you don't see anybody without a mobile. I'll give you another very practical example. When we take rounds in our hospitals, when we were in the teaching hospital, there's a case where a honorary asked his resident to examine the patient and tell the doctor about tell the honorary about presence or absence of retinopathy. And the resident said very clearly, sir, I've checked up, there is no retinopathy. So later on, when the patient went for ophthalmic reference for some problem in the eye, they realized that the right eye was not existing, it was an artificial eye. So the problem here was the honorary never bothered to himself check the patient. He just depended on the resident totally and completely. So the problem is not with AI. When we depend on the AI's hand-given diagnosis and treatment and we take it blindly, and that is called as automation bias in AI parlance, then things will go wrong. That's why what Madam said is a very accepted thing. It is called as human in the loop. It should not be AI in the loop. Don't let AI sit on your head. It's like when you have Mercedes and you're buying a Audi and you run it over the footpath and you kill so many people as some rich children of some industries have been doing. You don't blame the technology and Mercedes for that, right? It is a driver behind the wheel who's responsible. So how you use AI is your domain. It is your ethical responsibility. It is your concern how you use it. You're supposed to use AI to aid you and not to get carried away by the automation bias and blindly follow whatever AI is telling you and implement that. So I'll keep it short and crisp. I think that is the answer. It is a wonderful thing to have. Let's not A, get frightened and move away from it, and B, let's not get over dependent on it, forgetting our clinical acumen and our vast experience, because that is beyond an AI management.
Thank you.
Dr. Kulkarni,
Yes, Ashok, I appreciate that.
great one. But I fail to understand one thing. Will the AI will be able to differentiate between bronchial asthma or acute LVF when there is acute dyspnea? It has to be a doctor's stethoscope which will see whether there is bronchi or crepitations.
Yes. Nothing to replace doctor's brain first. Now, stethoscope from the days of the inventor to today's are modifiable. There are digital stethoscope, there are electronic stethoscope which identify creps from bronchi differently. And as said by Ima also in the initial part of it, doctor is in the driver's seat. He has to see the patient. It is for synthesizing and assimilating the response and further line of treatment where your AI is going to be helpful. Your question is absolutely right. It cannot replace a doctor.
And also, sir, it is not going to give you one diagnosis point. It will give doctors at least 5 most probable diagnoses. So among those 5,
Madam, the problem is here because once the patient sees the symptom or her symptoms, they go to Google, they just go to AI to diagnose their problem and they give hundreds of their differential diagnosis. They are so panicked that doctor also become panicked in that way.
yes, sir, this is a very good thing that you brought up. Even I was about to say this. So see, Googling a symptom is very different than AI, sir. Googling a symptom, that's why I said that patient is going to go to, no matter how many times you tell that do not Google it, the patient is going to Google, the patient is going to check on plenty of platforms. So why not give them an intelligent artificial intelligence system which is developed on AI models, sir, so that they are not distracted from their main complaint. The AI model is not that कि आपने एक कॉफ डाला और आपको वो ब्रोंकियल आस्मा दिखाएगा. ऐसा नहीं होता सर. वो आपकी हिस्ट्री लेगा, एसोसिएटेड सिम्टम्स पूछता है. लाइक माय प्रीवियस क्वेश्चन. सो मेरे प्रीवियस क्वेश्चन के हिसाब से वो पूछेगा सर, जैसे डॉक्टर होते हैं. एंड हाउ इट डज दैट? बिकॉज इट रीड्स द वास्ट डेटा सेट दैट इज अवेलेबल. So rather than Googling, why not give patients an intelligence system which talks to them like a doctor, identifies their symptom and gives them the most probable diagnosis and the specialist to connect. It's never going to tell them the treatment plan. That goes to the doctor's dashboard, sir. We never tell the patients that you have to do this. No, it goes to the doctor's dashboard. वहां हम उनको, जैसे मैंने आपको dizziness and vertigo का example दिया था. It guides that you need to go to an ENT specialist or you need to go to a neurologist for your vertigo. So this is how it helps. It's not Googling a symptom, sir. I hope...
मैडम, अगर AI करप्ट हो गया तो जैसे सॉफ्टवेयर भी तो करप्ट होते हैं.
सर, तो वो टीम होती है. If it breaks down and all, there is a technology team who fixes it.
नहीं देखिए, अभी एक बहुत बड़ा जो है पूरा गूगल उड़ गया, पूरा वो हो गया, तो AI भी तो देखो कंप्यूटर बेस्ड है, सॉफ्टवेयर बेस्ड है. अगर ये उड़ गया तो फिर क्या होगा?
अरे टेक्निकल प्रॉब्लम्स हमेशा होंगी. मस्ट रिमेंबर वन थिंग अशोक, दैट not going to use AI medicine. Your clinical sense that is going to count. That is very important.
विरमानी जी देखिए, एक ही इम्पोर्टेंट इसमें इशू है कि आपका जो क्लिनिकल साइन है जो आप इवेलुएट करते हो मरीज में, चाहे वो कार्डियोलॉजी के हो, चाहे वो मरमर हो, चाहे वो हार्ट साउंड हो, चाहे वो इको डॉपलर के इंटरप्रिटेशन हो, चाहे वो ईसीजी की ट्रेसिंग हो, ये तो आप ही उसको इंटरप्रेट करके बताओगे ना, तभी वो रिजल्ट देगा. तो क्लिनिकल स्किल रिमेन्स स्टिल your skill of making a diagnosis, your perception, your feeling of spleen. अगर अल्ट्रासाउंड में स्प्लीन कई बार नहीं पकड़ में आती है, कई बार बढ़िया अगर अल्ट्रासाउंड का ट्रांसड्यूसर नहीं है, अल्ट्रासाउंड की क्वालिटी बहुत अच्छी नहीं है, तो छोटे से ऑर्गन के इन्वॉल्वमेंट नहीं समझ में आते. लिम्फ, आजकल बहुत सारी परेशानी होती है. इलियोसिकल रीजन में लिम्फ नोड है, साइज उसकी कैसी है, मैटेड है कि अनमैटेड है, उसके अंदर दिखाई पड़ रहा है कि नहीं, नेक्रोटिक साइन दिखाई पड़ रहा है कि नहीं, स्टिल पेशेंट हैज पायरेक्सिया, कॉन्टूज इज नॉट पॉजिटिव. तो ये जो पजल है, डायग्नोस्टिक पजल है, ये एआई से सप्लीमेंट थोड़ा जरूर मिल सकता है, बट देन प्रोबेबली इट कैन बी एक्सप्लॉइटेड बाय द अनस्किल्ड पीपल. ये सबमिशन है. क्लिनिकल स्किल, क्लिनिकल टीचिंग, टच ऑफ द पेशेंट स्टिल रिमेन्स एट द हेल्म ऑफ द.
Yes, thank you, Dr. Kamlakar Tripathi. I agree that not only clinical skills touch the empathy. Empathy cannot be bought by any AI tool.
Sir, my question is, can my AI and your AI will be different? My AI and your AI will be different.
AI cannot be different because let me tell you one thing before I go to that. There are We are still in the infancy stage. We cannot take it as guaranteed that all of us are going to use AI Hamesha. Please remember there are issues of data privacy, there are ethical considerations, there are regulatory frameworks to be made, and we don't know whether the data that has been incorporated is correct or corrupted. So there are still a lot of issues that are coming up. I was reading a blog yesterday by a retired cardiologist from US who has just retired yesterday. And he written a blog and said that the EMR was one of the biggest nuisance in the history of medical profession in US. Because he said we were looking at the computers and not at the patient. We did not get time to see patients. So it has got its drawback. You must realize. So, and we must know it is judicious use of AI is important. When to use, when not to use, how much to depend on it. But we cannot forget our clinical sense. We cannot forget our empathy with the patient. We cannot forget the human touch. Let us remember this. This is very, very important. We may talk of AI, but we must remember the basics. Basics cannot go away.
Thank you, Dr. Anil Virmani, for your comments. Friends, there is always a threat of new technology. If you recall, when the computers were brought in banks, there were strikes. People were sitting on dharna in the squares that it is going to take out their job. And now you imagine banking without a mobile or without a computer-aided program. So any technology, any new thing in clinical medicine, whether it is an intensive care unit or even the concept of hand washing, that has faced great amount of lot of opposition from everybody. But this is one technology which is going to take you up. It is going to refine your skills. It is going to redefine it. You will be unlearning, you will be learning, and you will be relearning with the help of technology. And not the question which one of the doctors asked, that whether it will go for quacks to flourish. No. What quacks or what anybody has got is basically information. If that information is crystallized, that becomes knowledge. And when that knowledge, with our experience of 10 years of medical education and then our practice, it becomes a wisdom. We are applying wisdom in a very, very, very proper way with the help of AI. So it is up to us how to take help from it. When the cars were there initially, there were only Fiat and Ambassador. Then why people are adopting the new cars? Why not to drive the old cars only? So it is a technological paradigm. The world is changing. It is the medical profession which is using technology least. That was the reason, Dr. Anil Virmani, I was so much insistent upon all the API presidents and ICP deans to have a workshop every year. So let us adopt to it. It is there. It is knocking at our doorstep. Ima, you will agree with me that it is up to all of us. It is Alok also can explain that if you don't adopt it, somebody else is going to adopt and then overtake you. Even Dr. Parikh also can add to it. Our founder, Dr. Abhay Rai also is there. You can have your opinion.
Yes, sir. So the AI to function its best or give us any help, that help from the physicians and doctors is needed. That trust is needed. So we should give it a chance. Everyone deserves a chance. So does AI. So with all open heart and with the vision that yes, it is overtaking so many settings, like be it banking, be it the other departments. Healthcare, it can never overcome. The other departments, yes, AI can completely overtake and replace people. But in healthcare, it is not possible. In healthcare, there's always be a doctor in loop. A specialist's oversight will always be there. So AI is a wonderful, powerful tool, but we as doctor fraternities and we as healthcare givers, we also need to give AI a truthful chance. That's all I say. We have to give it a chance.
That's why the programs like this, which are going to help each other. And you have to practice it. You have to adopt it, because there are a lot of newer developments are there. See, has anybody joined a WhatsApp learning school till today? Has anybody joined an email learning school? No, we have learned it. Like that, AI tools are so wonderful. Suppose if you use the paid version of ChatGPT, and if you put a ECG image on that with the proper history, it will give a diagnosis. You can pick up a early STEMI by increase ST segment in AVR isolated, called as an orphan lead. But that ST segment elevation in AVR is not visible to your eyes. It can be possible only with that computer vision syndrome and the image recognition softwares. Suppose if you get a simple nodule in the chest, whether that nodule, whether it is a benign or malignant or hydatid or something else, the clues will be given by magnification of the images. And now I can see few of the pathologists also who are here, that the pathology segment, ophthalmology, radiology, and orthopedics has been really expanded like anything. My niece had a head injury. Her skull was broken. All the pieces were taken out, kept in her abdomen. They were realigned. They were printed by 3D technology. And now she is as fair as anybody in the world. That whole thing, that is the improvement, that is the magic of 3D printing. And it is not possible without AI. So Dr. Virmani, now it is almost 9:23. How much time you should continue?
Dr. Kulkarni, I hope I am audible. You can have comments from Dr. Parikh and Dr. Rai, sir.
Yes, I had requested them, Dr. Parikh sir. Parikh sir has been very kind to me. I respect him and I always thank him because in his inaugural address of API president, he has mentioned about technology and smartphones and AI. Dr. Parikh, please.
He's also our president-elect. He'll be taking over. Dr. Parikh, sir, please unmute yourself.
Dr. Rai, Dr. Abhinandan Rai.
Yeah. Dr. Professor Kulkarni, I agree with you and with the learned speaker that this AI is going to assist the clinician. It is going to give us the differential diagnosis of all it is not going to confuse us. It is going to add in the process of diagnosis. That's very important. Second is about the management. So you see what is the best treatment option. We can plan, clinician can plan, but it's going to help in the assist in what is the best management option. So AI is going to assist in the diagnosis as well as management. It is not going to replace the doctors. Thank you.
Perfectly, I agree with it.
Yes, yes. Sorry, there was some problem in the meeting. So let me compliment and congratulate Dr. Ima and Dr. Kulkarni for starting. This is such a great thing about AI, which for I think most of us do not know much about AI and not using much. So I think, as Dr. Kulkarni said, everything which comes latest, almost because we don't understand, we oppose it. As Ima Rashi said, you can treat it as your assistant so that the decision can be taken by you. So I think it is a wonderful presentation by Ima and excellent comments by Dr. Kulkarni, who is a master of AI and digital technology. And let me congratulate Dr. Virmani for a great initiative taken to disseminate the knowledge in every respect, and started with AI, which is so difficult, looks to be very difficult to, at least to me. I mean, how to understand and how to go and understand all these problems in AI. But I think with the time, as Dr. Kulkarni said, we are using social media, other things, we will be get accustomed with AI also. So thank you, Dr. Ima, Dr. Kulkarni, Dr. Rai, Dr. Virmani, and all delegates who are attending today's webinar. It's really a wonderful CME webinar on AI. Congratulations to everyone. Thank you.
Thank you, sir.
Thank you, sir.
Your blessings are always with us. I got a request to everybody that there is one digital global summit on AI which is going to happen from India. That is on 14th and 15th December. And you can join a group called as the Doctors AI. Dr. Anil Virmani is one of the component of that group who thinks about better technology deliverance in healthcare. And it will be really good thing to know from basics to the most advanced things in AI. And most important is, even if you miss any of the session, for the next 2 months, we are going to make available all the videos, and at request, we can even share you the slides also. So thank you. Thank you, Dr. Virmani. Thank you, Dr. Ima, for your wonderful presentation. It was a really story-like thing, and I appreciated your efforts. It is almost now 90 minutes, and everybody must be thinking about their dreams. So I say my best wishes to all of you from my side, Navi Mumbai, and let us, develop much better and more, as a intelligent physician with the help of AI. Thank you.
Thank you.
Thank you. Thank you, everyone. It was wonderful to speak on a platform like this and with such esteemed personalities and my seniors. So all the best, everyone. Let's just see where we go with AI and treat it as our physician assistant and give it a chance. So have a good week ahead, everyone. And thank you, everyone. Thank you. Bye.
Thank you.
Anil.
Thanks, Emma.
Bye-bye.
And thank you to Professor Kulkarni, sir, all the senior members. May I request Mrityunjay, sir, to propose the vote of thanks?
Well, thank you, Abhishek. It is initial, yes, as far as AI is concerned. Oh, am I audible?
Yes, you are.
Okay. So it is initial year as far as AI is concerned, and we are taking a big plunge into the ocean of AI. So thank you, Dr. Ima ma'am, for teaching us about the AI. And since we are learning it, so we are taking cautious approach. But things are that future will be doctors without AI, doctors with AI. And rightly said by our Dean, Dr. Birmani sir. And I must also thank you, Dr. B.S. Kulkarni sir, for keeping things in right perspective. I would also like to thank Dr. Taneja sir, Dr. Parikh sir, Dr. Modi sir, Dr. Renda sir, all for giving their valuable comment. And I would also like to thank Abhishek for keeping things in well perspective. So thank you all of you again. We will meet soon in January. I think in January, na sir? Dr. Birmani sir?
Yes, January. I think it's 16 January, Sunday. Dr. V. Mohan will be our staff speaker, and the topic will be lessons learned from epidemiological studies.
So हम लोग AI को छोड़ने वाले नहीं हैं, इसको पकड़ने वाले हैं.
Yes.
वो तो
Thank you.
workshop कर रहे हैं ना,
We are going to have a workshop. और आज के टॉक के बाद, डॉक्टर इमा मैम के टॉक के बाद हम लोग काफी इसके बारे में जाने हैं. तो थैंक यू वेरी मच टू ऑल ऑफ यू. थैंक यू फॉर ज्वाइनिंग अस. थैंक यू.
Yes, thank you, Dr. Virmani.
Yes, sir.
Thank you. Good night. Take care.
Good night.
Good night, everyone. Good night.
Good night. Good night. Thank you, Ima, very much.
Thank you, sir. Thank you, sir. Thank you, sir.
Thank you.
Ima,
Bye-bye.
इमा, जिन लोगों को देख करके हम लोग बड़े हुए हैं, जिन टीचर्स को आज सब लोगों ने तुमको सुना है, वेरी वेरी
It is indeed an honor, Abhishek. That's what I said. It is indeed an honor to present this with the seniors and esteemed seniors of mine. So I take it both as a privilege and an honor. So thank you so much, Abhishek, and thank you, sir.
तुमने बहुत कम टाइम में प्रिपेयर किया, क्योंकि हम लोग और डॉक्टर बिरमानी सर एक जगह अयोध्या में थे, तो वी प्लान्ड कि भाई इस वीकेंड क्या किया जाए, किस तरह से किया जाए. तो ये आपका एफर्ट बहुत अच्छा रहा, एंड नो डाउट एआई में बहुत कुछ सीखना है, एंड वी विल कीप यू इन लूप. तो तुम भी हमारी याद से मेंबर हो एक तरह से, ठीक है?
Sure.
Definitely.
Ima and Abhishek, thank you very much. And we'll be in touch with each other, and we'll be sharing whatever new information we are having and how we can, progress together, both vertically, horizontally.
Sure.
Leaps and bounds. It is always progression by X raised to 2 in the field of AI.
Yeah, sure, sir.
Yeah.
Sure.
And Ima, when you are in Navi Mumbai, please let me know. We can interact or we can have some other technical things which are as good inputs.
Sure, sir. And same here. Once you come to Bangalore, please let me know.
Thank you. Sure. Bye.
Bye-bye.
Thank you, sir.
Bye.
Good night.
Thank you.
Good
Good night
night.
all.
Good night, everyone. Bye-bye.